Welcome to Elephant in the Room, a podcast featuring real conversations with real therapists on the elephant in every room, trauma. With this show, we are aiming to share insights from professional practitioners on trauma, its impacts, as well as various modalities and resources on healing for survivors. This podcast is produced by the Breaking Free Foundation, a Canadian registered charity that supports trauma survivors in reclaiming their lives and finding healing. All of the therapists interviewed on this podcast are members of the Breaking Free Foundation Trauma Practitioner Network. My name is Amber Craig. I am a trauma survivor, one of the co-founders of the Breaking Free Foundation, and the proud host of this podcast. Today, I am pleased to be joined by Natasha Thibodeau. Natasha is a registered social worker at Monarch Psychology in Calgary. She works with children, youth, and families in her practice and uses approaches like CBT, EMDR, play therapy, and TheraPlay. Please welcome to the podcast, Natasha. Thank you for being here.
Hi, Amber. Thanks for having me. I'm excited to chat with you today.
Yeah, this is going to be a great conversation. Just to get us going, I'd love for you to just give a little bit more of a background on your professional experience and the areas of expertise that you work in.
Okay, so I'm a registered social worker. I have a Bachelor of Social Work and a Master's in Social Work. I got my BSW in 2010 with the intention of going into child welfare, which I did and spent quite a few years there. When I was there, I was doing pretty much just case management, which involved assessment, intervention, crisis management, permanency planning for kids, making referrals to different services and community agencies, working with kids really of all ages and their families impacted by trauma, which is obviously our topic today. And I worked for a little while at Hull, which is located in Calgary, Hull Services, and they house a bunch of different residential treatment programs for kids and youth, and also some other community resources, some different mental health programs for the community that aren't residential. I have some experience working in adolescent inpatient mental health. And once I got my master's degree, which involved that as my practicum, then I went into working at a community agency providing clinical support for caregivers of children in care. So doing just lots of trauma-informed and attachment-based work with caregivers to understand what's going on for kids and to support them with what might be happening for the kids in their care, and to just really prevent placement breakdowns, or try to, and support permanency for kids. And just be an additional support as a member of the case team. And while I was in that position, I was also doing counseling. So I was doing counseling with adults, kids, and a little bit of group counseling. And now I am in private practice with Monarch Psychology. And currently, I primarily practice with a trauma-informed and attachment-based lens. I specialize primarily in early childhood and perinatal mental health, but I really love everything, because really to me, everything kind of goes back to what happened to you in childhood and what kind of experiences have you had as a child that have led you to be who you are with all the stuff that's going on for you. So I love working with teens. I love working with adults who may or may not become parents. I love working with parents. Really anybody that comes in that says I'm struggling with anxiety or depression symptoms, perfectionism, stress, burnout. Usually once we start digging into it, there's some childhood stuff. So I really love just working across the lifespan, but primarily my passion is early childhood and perinatal mental health. So I'm currently trying to specialize more in that area with goals of doing additional training and specialization in that area specifically.
Okay, this is perfect. So obviously for our listeners, you have a lot of experience in this area, which is setting us up perfectly for what I want to talk about today, which is childhood trauma. And I mentioned to you before we started recording that we actually haven't really dove into this in great detail on this podcast, which is very ironic because it's how our charity started. But just to kind of kick off this conversation today, can you define what childhood trauma is?
Okay, so this is going to be probably a really long explanation. There's a lot going on here. It's so complex. So generally, I think about a trauma for a child as something that has happened for them that has threatened or damaged their emotional or physical health. That is actually consistent also with the National Child Traumatic Stress Network's definition. So that can include things like physical, sexual, emotional abuse, neglect, and exposure to other events outside of the family or outside of the home. That can include violence from other areas, injuries, accidents, natural disasters. But then I also really look at it from an attachment perspective and a brain development perspective. So a huge influence on my work and a big reason why I ended up being a therapist and even probably stayed in child welfare for as long as I did, is Bruce Perry's work. So Bruce Perry is a brilliant child psychiatrist who came up with this neurosequential model of therapeutics. So essentially, the idea is that the brain develops from the bottom up, which really just means that it starts with your brainstem and goes into the limbic system, and then finally the cortex and the prefrontal cortex, which is usually not fully developed until people are like in their mid-20s. So I think about trauma as really any experience that is impairing that brain development process. And Bruce Perry himself identifies trauma specifically as an experience or pattern of experiences that is impairing the proper functioning of the person's stress response system. So essentially, if somebody's exposed to chronic stressors, their stress response system is going to be used to going off all the time, and it's going to become more sensitive to different stimuli in that person's environment that possibly are not even actually a real threat. So that's how Bruce Perry looks at it. That's kind of how I look at it. That's how a lot of people that work with child trauma look at it. Because we know that when we're exposed to stress, our fight or flight or freeze response is triggered in reaction to the threat. And the more that certain neural pathways are used within the brain, the stronger those get. So the more that that stress response is triggered in response to a specific threat in the environment, the more sensitive it's going to become to that. And the less that other stuff is happening in the brain, like the actual healthy development that we want happening in a child's brain, the less stuff there is going to develop. So generally, in terms of brain development, we think in terms of sequential development. So if there's impairment in really early childhood or infancy that impairs that initial brainstem development and kind of hijacks that stress response system, then that's going to kind of spill over into the rest of the child's brain development. So it can cause impairments just across the board. There's probably more I have to say about that. Give me one sec. Oh, going back to attachment. So there's this concept of complex or developmental trauma. So that really refers to that early childhood trauma, essentially, that occurs in the relationship with the caregiver. So that's this chronic relational trauma that's happening that can really look like all kinds of different things. So it's really hard to put a specific definition on like what is childhood trauma, because it really is so subjective, first of all, because two kids in the same family can be experiencing similar environmental stressors, similar caregiving, and it can affect them in a completely different way for each child. So there's that, but then there's also like all of this other systemic stuff that plays a role. So we've got like poverty, we've got systemic racism, we've got all kinds of other issues that I'm going to get into because I'm trying to keep my thoughts straight right now because I've got many things I want to say. But there's like all these bigger systemic issues, like how society is broken. Because I'm going to talk about Gabor Mate, who I know you're a big fan of. Yes. Because there's so many other issues in society that impact families, that impact communities, that impact children. So all of these other things are kind of intermingled. And the primary thing that's happening is that relationship, that early relationship that child is building with their caregivers. And that's really based on these serve and return interactions where a child is pitching out a cue. They're saying, hey, I need this thing from you, caregiver. And the caregiver is responding. And it's how does the caregiver respond? How often does the caregiver respond? And the caregiver actually doesn't have to respond to the cue properly that often, which is great, kind of scary, but also like really right. Because caregivers can make a lot of mistakes. Parents can not meet every single cue, and they're not traumatizing their child. They're going to meet like, I think it's like 30% of cues. If you're meeting 30% of cues, generally things are okay. So what does that early attachment relationship look like with that caregiver? Does the child have a sense of stability and safety and that they can rely on the caregiver? And that also goes into this concept of the internal working model, which is based on Bowlby's attachment work. And that really is the set of beliefs that a child develops in response to those early relationships and life experiences. So who am I? Am I worthy? Am I lovable? Am I not worthy? Am I not lovable? Am I important? Not important? What does my caregiver do? What can I expect from them? Are they safe? Are they trustworthy? Are they nurturing? Are they going to meet my needs? Or are they scary? Are they not going to meet my needs? Are they not reliable?
Right.
And also, what do I believe about the world? Is the world inherently safe and people are good? Or is it the opposite? The world is scary. I need to keep myself safe. I can't interact with the world. I feel like I'm missing some stuff here, but that's generally where I'm trying to go with this.
I know it's a big question that's going to have a really big answer, and you painted lovely examples of that. This is also kind of a massive question, but when I think the biggest reason I'm going to ask this, which is like, what kinds of experiences could contribute to childhood trauma, knowing that that could be anything like you just mentioned, people could grow up in the same house and experience the same thing, but have different reactions. I guess what I'm looking for is for someone listening to this, could we give some examples that might make them think that, okay, that makes sense to me? Like, what are some examples of experiences that could contribute to what would be defined as childhood trauma?
So I tend to think, first of all, of adverse childhood experiences, which are based on a study that was done, I want to say in the 80s or 90s. It was a study that was done with a group of thousands of people to determine if early childhood adversity had an impact on long-term mental health or health outcomes, including mental health. And surprise, there was a huge connection. So in that specific situation, adverse childhood experiences were defined as physical, emotional, or sexual abuse, physical or emotional neglect, being exposed to domestic violence, having a parent who's struggling with their mental health, having a parent who's struggling with substance use, having parents who are separated, or having a parent who's incarcerated. And I tend to think of it in terms of that initially, but then there's a whole bunch of other types of things that can play a role there. And then I think about things like what's going on for the parents specifically. What does their support system look like? What kind of issues are they dealing with? What kind of environment surrounds the family and this child that is contributing to what's going on for that child? And also thinking about the things that I just mentioned in terms of ACEs, specifically, I'm thinking about how that impacts the parent's ability to respond to the child and to meet their needs. So when we're talking about parental mental health struggles, that's not because the parent's doing something wrong or trying to inflict something on the child. It's because that experience for the parent is going to alter their ability to respond to the child in perhaps the way that the child needs to. It doesn't mean that happens across the board, that every parent struggling with their mental health is going to be an ACE for their child. Like we collect all of the information if we're doing the ACEs with somebody, but it doesn't mean that every person who has like 5 out of 10 is going to have exactly the same outcome.
Right. Yeah. And I think obviously there's experiences in childhood that can impact you for a lifetime without proper intervention. If we're looking at childhood trauma specifically in kids actively, what are some of the symptoms that might be manifesting in children who are experiencing trauma?
Okay, this is a long answer. It really depends. It depends on so many factors. But generally, I put together kind of the whole list of everything that possibly could be thought of. There's probably more. There's probably things I missed. But we might see a child that looks like they're stuck in their survival brain because, again, they might be really hypersensitive to cues from their environment that tell them that there's danger, even if there's not. So you might see a child that's really hypervigilant. They're really easily triggered. They go into fight, flight, or freeze really easily. And I'll talk a bit more about what that looks like behaviorally. They might struggle to have relationships with people. If you've got a child that doesn't have a secure attachment style, that child's going to struggle with other people, not just the caregivers. And in terms of attachment, generally, we think of 4 different types of attachment. There's a secure attachment style, and then there's 3 different types of insecure attachment, which are generally anxious, avoidant, and disorganized. It's a little bit more complicated. They have slightly different names in kids and in adults, but I'm not going to get into that right now. But we might see different symptoms, I guess, of different attachment styles. So kids are going to show up in different ways with people, with their caregivers, with teachers, with their peers, and in later relationships in life. So there's that whole piece. So thinking about that and thinking about the stress response system and the different responses to stressors, we might see things like a lack of impulse control. We might see fighting. We might see aggression. We might see in older kids substance use. We might see self-harm. We might see suicidal ideation or behavior. We might see other symptoms of depression, anxiety. We might see school refusal. We might see a kid that wants to control everything in their life. We might see impairments in executive functioning, because that's that prefrontal cortex piece. So that's not even going to be fully developed in a young child anyways, but if it's been further hijacked by trauma experiences, you're going to see a younger developmental age. So that's another piece, that we're going to see kids that are acting in a way that doesn't match their chronological age. And often that does look like developmental delays in areas like social emotional skills, problem solving, gross motor skills, fine motor skills, social skills, speech and language. Going back to executive functioning, we're going to see problems with impulse control, emotional regulation, ability to plan for things, ability to foresee consequences. So often kids exposed to trauma have lots of problems in school. We might also see issues like in the brainstem. So not only like are we seeing a kid that has a stress response that's totally amplified, but we might see sensory issues. We might see somatic issues in kids, and all of that stuff is connected to brainstem development. We might see attention difficulties. We might see difficulty switching tasks. We might see low self-esteem, dissociation, where a kid is kind of like off in their own world. There's kind of a continuum, so it can look like a kid is just really daydreaming, or we can have like more extreme dissociation where it is quite obvious that the child is like somewhere else in their head. And then of course we can see classic PTSD symptoms, which are, I think, quite limiting when it comes to thinking about what trauma is. But in terms of PTSD, we're talking about things like flashbacks, nightmares, intrusive, distressing memories, avoiding reminders of the event that caused the trauma, and cognitive, emotional dysregulation, and hypervigilance and reactivity. I think that's all I got. But I mean, it really is such a broad answer because it looks different for every kid.
Yeah. I think that's still helpful though, because again, it's, I mean, I don't know what the chances are that an actual child is listening to this, but there's probably a lot of adults who could be reflecting on their own lives or the lives of their children. When we think about adults and unresolved childhood trauma, is that list of symptoms different? Are there certain things that might show up in an adult who had experienced childhood trauma that would be different from the list you just said?
A lot of it is the same for sure, because especially if you have a kid that has these issues and isn't getting support with them or isn't getting trauma treatment, then the issues are going to just persist. So a lot of this is going to stay the same. But then I also go back to that list of ACEs and that whole study in terms of what they found in terms of later health outcomes, because that population was adults. So we're talking about things like not only mental health stuff, like depression and suicidality and anxiety, but we're also talking about things like substance use and heart disease and smoking and cancer and unemployment, poor academic achievement. So we're going to see areas across people's lives that are affected. So when people experience childhood trauma, and this is why this is really my lens of thinking, and not everybody has experienced trauma to the same degree or at all in some cases, but usually when somebody is experiencing hardship in adulthood, we trace it back to something that happened to them early in life. So it really can cause all kinds of problems. And so when somebody comes into my office and says, oh, I'm really struggling with depression, or I'm really struggling with anxiety, or I'm really struggling in my relationship, or I'm really struggling with parenting, no matter what they want to talk about, I'm like, okay, let's like dig in there and get to the bottom of like where this originated, because it didn't just happen. This has probably existed for a while. And I want to know, like, where did it come from? And often it does come from childhood. I don't know if
Yeah,
that
I
answers your
think
question, Amber.
it does. Yeah, and I think it's just a really good thing to circle back to is changing the dynamic of that conversation of what happened to you, and that's a question that maybe doesn't get asked enough. You did mention earlier in our conversation about, parenting style, and I am curious how, if somebody has experienced trauma in their childhood and they become a parent, what are some ways that that experience can influence their parenting style?
So again, even just going back to the ACEs, if we've got a parent that's struggling with their mental health, they might be in a more difficult position to be able to provide what that child needs in terms of attachment, and possibly even some of their physical needs that they need to be met. And then also, if you've got a parent that is dealing with substance use, which can often be something that comes from childhood trauma, that can also impact parenting. And then I really love this model called circle of security, because it's essentially based on the idea that it's attachment based. It's based on the idea that we bring with us into our parenting how we were parented. So if we had a parent that struggled with a certain thing, we might struggle with that also. And we tend to kind of automatically go into parenthood with that mindset and that lens without really even thinking about it. It's kind of subconscious, because we're trying to protect our kids. So we're like, okay, like this is what kept me safe, so I'm going to pass this along to you because that's just the way it is. And to explain it a little bit better, because I recognize that was not great. I'm just pulling up my circle of security graphic here. So generally, it's based on a graphic of a circle. Surprise, circle of security is a circle. So the top of the circle is, there's a set of hands on the side. I should probably say that. There's a
Right.
set of hands, and then you've got your
Yep.
circle. So the top of the circle is where a parent is a secure base for their child. So that's where they are supporting the child going out into the world and exploring. They're going to watch over the child, delight in them, help them with anything they might need help with, and enjoy things with them. On the bottom of the circle, that's where the parents can be a safe haven for their child. So the child is able to come to the parent is welcoming them in when they need something. So the parent is going to comfort the child, protect them, delight in them again, and or help them organize their feelings. And then the hands are, whenever we can, being bigger, stronger, wiser, and kind while we're doing all this other stuff. So as you can probably imagine, like most of us don't get that right, because we all have our own stuff that we bring into parenting. And so we investigate a little bit, where does that come from in this model? And there's individuals that do this. I'm not a trained facilitator, so I bring it into my work, but I don't do the full process with people. But there's lots of great groups, and I can talk later about where to access those. But essentially, the work of circle of security is identifying, where do I struggle on the circle, or do I struggle with the hands themselves, and why? Like, what happened that is making me struggle with that? So there's a lot of self-reflection that comes with it, in terms of like, what happened for me that I struggle with this, and how can I do something about this? How can I recognize what's happening in the moment? If I'm really struggling to let my child go out and explore the world because that makes me feel really anxious, why? What happened that's making me kind of automatically do that? And how do I recognize that when it's happening and interrupt that cycle? And the same with the bottom. If I'm really struggling with my child's emotions, they're a trigger for me. Where is that coming from? So I really love that model in terms of parenting, because it can be really helpful in helping people think about, okay, what does parenting actually look like in that dynamic with the child? And how did I get impacted, and how can I change that? So I really love that model. And then the other piece that I want to talk about regarding parenting specifically is if we've got somebody that's really struggling with their own mental health and their ability to be regulated, they're going to struggle to offer something called co-regulation to their child. So kids have super underdeveloped brains. They do not know how to regulate themselves, contrary to like some historical beliefs that are really frustrating. Small children cannot regulate themselves. They need an adult to help them. They have an underdeveloped brain. We need to be their brain. So essentially co-regulation is we regulate ourselves with the child so that we use ourselves to help them regulate. So if I'm a parent dealing with a dysregulated child who's freaking out, screaming, crying, I might go in with a calm voice and get down on the child's level and validate what's going on for them. Wow, you look really sad right now. This seems really frustrating. And then I might just sit with them and be calm, and my calm presence will help them regulate. Or if they're older, they might be able to do something if I'm guiding them through it. Let's take some deep breaths. Let's count the birds outside of our window, or something that kind of helps to bring that child back to their baseline. And let's just be honest, every parent struggles with this. This does not need to be somebody who has been exposed to their own childhood trauma. Parenting is really hard and it can be really triggering. And to just stay regulated all the time, nobody can do that. So that piece can be further exacerbated in somebody that's experiencing their own stuff. So I really love helping people to unpack what happened to them and start dealing with that stuff. I think this is one of your next questions, or it ties into it. But I really love helping parents figure out how their experiences have impacted them as a parent. A lot of parents are like, oh my gosh, something's going on for my kid. And they're worried about their child. They're like, hey, you're a therapist. Here you go. And I would really love to just wave a magic wand, but it's a lot more complicated than that. And the most important work with kids really happens with their parents. So for parents to dive into their own work and do their own work is so impactful for kids. And that's why I really love working with adults and with parents. Not that I don't like working with kids. I love that too. But we get the most mileage, I find, in a clinical situation working with parents. So I feel like I went off on a bit of a tangent, but
I think you might have already kind of answered this in that what you just said, but earlier you sort of mentioned something important that I wanted to circle back to, which was that like parents end up bringing the experiences they went through with their parents into their own parenting style and repeating behaviors, good or bad. So how can someone who has gone through trauma in childhood and is now a parent, how do they break that cycle of not repeating what happened to them? Like you just mentioned doing their own work. What else could you kind of speak to on that?
So definitely reflecting on our own stuff. And that's really hard. It's really hard to be like, hey, here's all the ways that I am not doing a great job. But it's really humbling. I will tell you from personal experience. But it's also so important, because if we are really wanting to break this cycle, the really amazing news is that we totally can. It doesn't mean it's going to be easy work, but the first piece is definitely recognizing what is our own stuff. What has happened to us? How has it impacted us? And how are we bringing that into our relationship with our kids and just relationships in general, and just like our way of being? What's our internal working model? What does that look like? Because that's going to affect our kids. And healthy parents mean healthy kids. So that's a big piece. Parents having their own support network is also really, really crucial. And that we live in a society where that's not really a thing for a lot of people. We're really insulated as families, and even within communities, we really are kind of like in a little corner by ourselves sometimes. And there's not a lot of really good support for families, like even starting from pregnancy and beyond. It's not amazing, as you know, and Gabor Mate has a lot to say about that.
Yes.
So there's the piece of like, what power do we have? Because yes, we can try to change the system, and we should, but that's really hard work. And lots of people don't have that in them. Fair enough. Like we're just trying to survive and do our own thing. So just really trying to cultivate our own support networks can be really important. And understanding how brains develop. I really love doing basic psychoeducation with parents right from the get-go, because I will talk about how the brain develops from the bottom up. I'll talk about attachment. I'll talk about this wonderful thing called the hand-brain model, which is Dan Siegal's work, where basically the stress response originates in your brainstem, which is my wrist, and then goes up through your limbic system, which is the hippocampus and the amygdala. So emotions and memory happen there. And then it goes up and our prefrontal cortex is here. So essentially what's happening is when we've got somebody that's in their stress response system, they're flipping their lid. So I love this because it's so simple. I have done this a billion times in sessions because it's so impactful for people. I'm like, hey, when you flip your lid, what does that look like? And when your child flips their lid, what does that look like? And it's just really easy to recognize that, oh yeah, maybe I have flipped my lid. And when I do that, what happens to me? What happens for me? And how can I put my lid back on? So I do a lot of work around just like basic emotional literacy and regulation with adults and kids, because even just that, like understanding our emotions can go such a far way. And the other piece, actually probably the biggest piece, I don't know why I didn't start with this, is the relationship and connection. Everything goes back to the relationship. And if we can just focus on the relationship, that can make so much of a difference. And parents have a lot of different stressors happening. There's a lot going on for parents where it's easy to forget to focus on the relationship. And really, like a lot of people don't say, oh, you should focus on the relationship. People are like, why isn't your kid listening? Why isn't your kid more independent? Why isn't your kid doing this? Why are they behaving badly? Why are they having emotions? There's lots of judgment in society. And like even some parenting advice is not great. And really, if we just focus on the connection, that's like magic in that parent-child relationship. And Gordon Neufeld talks a lot about connection and attachment. He's a Canadian, I want to say psychiatrist, psychologist. I'm probably getting that wrong. And I think he's Canadian. Anyways, I told you I'm going to be all over the place today. It's the excitement. I've flipped my lid. But he always goes back to that connection and fostering that relationship with our kids. And in a lot of work that we do with families and like dyadic parent-child therapy, we do really try to focus a lot on connection and fun and joy and play, because that is so healing to a child's brain. And play is ultimately the language of a child. That helps them learn about their world. It helps them process trauma. So that's not a short answer, but there's a lot that parents who have experienced their own trauma can consider, and it can feel really overwhelming. But really, it like taking things a piece at a time, a day at a time. Like, can I just regulate myself in this moment? That's a huge success for parents that have experienced their own stuff, and recognizing, hey, this has happened for me and I really want to do things differently and I really want to break the cycle. That's amazing. That in and of itself is so, so amazing. So when I have people come to me that say that, I just really want to celebrate that, because that's the first step. We're not just keeping on and going the way that we're used to things happening. We're trying to do something different. So it's pretty cool when people show up and they're like, oh my God, I don't know what to do. And I'm like, but you're doing like half the work right now. There's some more work
for sure.
But like, this is great.
Yeah.
Here. So
it's a giant
there's definitely
first step for sure.
Oh, what's that?
I just said it's like the first step is the biggest and almost the most important, right?
Yeah. And then once I get them in the door, I'm like, okay, let me just figure out where we're going to go. And often that does involve just really normalizing things. Like, hey, this is normal. You are not a bad parent. You are doing the best you can with what you've got. And like, you're doing a pretty good job considering. And here's some more information about how the brain works and how you can really foster healthy brain development in your child and really focus on that connection with them. And it really is a piece at a time. But it can be so impactful, every little piece.
So as we know, like your brain is still developing when you're a child. So it's pretty unlikely, although it could happen, I guess, that a child is going to come to their parents and say, I'm experiencing trauma. They're probably not going to say that way. So for parents that are listening to this and there's maybe some light bulbs going on for them about themselves or their own kids, like what would be some warning signs for a parent that their child is experiencing something traumatic right now?
I'm gonna just kind of default back to that whole list that we talked about
Yeah,
earlier, where um, and it depends on the child. It's really hard to know what's going on for kids because some stuff is developmentally normal for kids. Some stuff is abnormal for kids, and parents know their children best. So I always want to hear from the parent, like what's going on? Is this normal?
mm-hmm.
What's your child's history? Who are they? Because they know best about their child. So ultimately, I would say parents can definitely look out for things that we've already discussed. They can look out for a
Right.
child that is anxious or is bullying people or being bullied, struggling with their own emotions, struggling to pay attention at school, struggling with all of the other things I talked about. But the other thing too is if there's a sudden change. If you've got a child that's experiencing something traumatic for a long time, like for example, if you've got two parents that are separated and the child is going between homes and something that's not so great is happening in one of the homes, you might not see an abrupt change in the child. You might just see some of the stuff that we've already discussed. Um,
Mm-hmm.
but even that can be tricky because separation of parents can be traumatic for a child. So that can cause
Right.
all kinds of behavioral stuff that happens. So it's hard to really identify what exactly might be going on. But yeah, the other piece is definitely if something abruptly changes, that's for sure a clue that something might be happening here that's worth investigating. And also I go back to the connection piece with this, and talking about emotions with kids and validating their emotions. Because if we are fostering a healthy relationship with our children and we're teaching them about emotions, which is by validating them when they come up and helping them work through them and recognizing when we have emotions and telling our children, I'm angry. I need to go take some time to manage that, and really normalizing having emotions. Our kids are more likely to come and tell us when something's going on. And we're
Right.
going to foster better relationships with our children. So our kids are going to be closer to us. And we would hopefully notice if something happens. But hopefully they would come tell you. They might not. But the other piece too that I think about having this conversation is teaching kids about safety, teaching kids about like what's acceptable and what's not. And I'm specifically thinking about things like body safety. I'm thinking
Right.
about teaching young kids, like as soon as you can teach them this, they don't have to be very old. Like, what are the proper names for their body parts so that they
Right.
understand what their body is and they can tell somebody certain things about it if they need to disclose
Right.
something that might have happened to them. Also, having their own boundaries for their body or boundaries in general, so that if somebody crosses those boundaries, the child is able to recognize, oh, wait, this isn't okay. And having conversations with kids about secrets. So a secret and a surprise can be perceived in two different ways. Kids can kind of get them confused, because sometimes keeping things a secret because it's a surprise is a really
Right.
normal part of life for kids. Like,
Right.
oh, this is a surprise. I'm gonna throw a party for your sister or whatever. Um, but keeping something secret is different, especially if it's
Right.
somebody that you shouldn't be keeping secrets from. Like if it's mom and dad, maybe you shouldn't be keeping secrets from them. But if a child isn't taught
Mm-hmm.
that, they're not going to necessarily know. They might just be like, okay, yeah, this is a secret. And the other thing too that makes this a little bit more complicated is sometimes often children will develop a sense of guilt or shame if something is happening to them, especially if they need to
Right.
keep it secret. So again, it kind of goes back to watching for things that are happening with kids, recognizing if something has shifted, and just trying to continually foster that relationship with kids. Um, Understanding normal child development. I mean, some like teenagers, for example, aren't always going to be like, hey,
Right.
we have this big deep conversation with you. So within reason, but generally starting as early as you can, having these conversations with kids and just trying to build a healthy relationship so that they know that they can come and talk to you about things and they form an internal working model that my caregivers are
Right.
trustworthy. I can go to them when I'm having a problem. And that doesn't need to start at infancy. Like if there is trauma, if
Hmm.
something happens, parents and caregivers can start this anytime because trauma can be healed, attachment ruptures can be repaired, and there really is a lot of hope for treating this stuff, even if it doesn't start from like day one, everything's perfect, because nobody's
Right.
gonna get it right 100% of the time. No parent is perfect. Every child experiences something that doesn't make them feel great. It's just the degree
Right.
to which that affects them and how much stability they have in their lives, how much support they have around them, what all of the other people in their lives are doing, what's their understanding of what's happened to kids. So all of these factors really work together to support kids and families. And there's definitely lots of hope when things are going well.
Yeah, I think that's a perfect segue into my next question, which is regarding treatment options for children in particular. What kinds of therapy have you seen be really effective with kids?
So with kids specifically, okay, so this isn't really therapy per se. This is kind of something that should be part of working with traumatized kids, regardless of what kind of specific kind of therapy model we're using. But everybody in the child's life should be on the same page about what's happening for that child. So like I kind of just said, everybody that's involved with that kid understands what's going on for them. So if you've got parents and their child is struggling with, like, I don't know, they're acting out at school, and we figure out what's going on that's causing that, everybody should be on board with that trauma-informed explanation. This is where this behavior is coming from. This isn't just a bad kid. And often schools can kind of see kids as being disruptive or not being well behaved or whatnot. It can be a place where they really get a negative label, because that's where we start to think about things like psychoeducational assessments and coding and diagnosing kids. And then once we start to get into that territory, it can get really murky in terms of like who really thinks what. Like do people actually understand
Right.
this is a trauma response, or are there people in this kid's life that just think this is a bad kid?
Right.
And I could go on a tangent, but I'm not. But yes, anyways, everybody on the same page. We want teachers to understand what's going on. We want therapists to understand what's going on. We want other care providers in this child's life to understand what's going on, doctors, and to all be on the same page about what's happening for this kid and what we're doing about it. So that is the biggest piece that I think kind of underscores everything else. And we want these people to all have an understanding of trauma, understand that
Right.
certain things can impair child development and cause behavioral problems, other problems, but often it is seen initially as behavior, sometimes cognitive. But when we've got kids that go into school, that's where often we're like, oh, something's happening. And it's usually because a child is exhibiting a specific behavior, whether that's like
Right.
an externalizing behavior, like they're aggressive, they're having outbursts, they're not listening to teachers, or it's an internalizing behavior. They're withdrawn, they're maybe feeling really anxious, but they're not displaying any real outward signs of anxiety other than like maybe avoiding certain situations.
Right.
Another piece that's really important is recognizing that sometimes we really need to start in the brainstem. We're probably not going to jump in there with some talk therapy and have a really great outcome if we've got deficits in lower level brain development. So we need to recognize where are their deficits. And that's what I really love about Bruce Perry's neurosequential model of therapeutics, because there's something that can be done in that model called brain mapping, where we can kind of get a history of everything that's happened for a child and figure out where there might be deficits in brain development from the bottom up. And we can create a treatment plan based on that. So essentially, if there's something going on where the child really needs something for their brainstem, they might really need like some sensory work or something, then that might be the initial part of the treatment plan before we go on to all of the other stuff. And a huge issue for sure is creating safety and trust, because we're not going to get very far with anybody who's experienced trauma unless we have safety and trust initially in that therapeutic relationship. So that's another piece. If a child is presently experiencing ongoing trauma, that's something that needs to be addressed before we can move forward.
Right.
The other piece that I touched on too is recognizing where kids are at developmentally instead of their chronological age. So you might have a 12-year-old that is presenting more like a 5-year-old developmentally because of brain development.
Right.
So tailoring treatment to what is actually going on for that child developmentally. Specifically, I really like doing psychoeducation, as I mentioned, with parents and caregivers in terms of what does brain development look like? What is attachment? How does that show up? What kinds of behaviors can we expect when we've had a child who's been exposed to trauma? And that really comes from my work as a caregiver support clinician. So in that program, I was working specifically with foster parents and kinship caregivers to support them to parent kids in care that were in their homes. So we used a model called attachment regulation and competency. So that model is trauma informed. It's based on the whole idea of how kids are impacted by trauma. So it's a really nice comprehensive model that addresses a bunch of different levels of what's going on for kids, and there's different domains. So that is a great model. I'm only recently trained in this, but I really love TheraPlay so far because it's, again, trauma informed, totally based on attachment. So in TheraPlay, we are able to treat different behavioral stuff that we might see in kids, social stuff that might be going on, relationship issues. It's been used a lot with kids in care. So kids that are in foster care, kinship care, kids that have been adopted. And essentially in TheraPlay, we're targeting 4 different dimensions that support healthy parent-child relationships or attachment. So we're looking at structure. So the parent's ability or the caregiver's ability to create safety, create structure, create boundaries and limits for the child. Engagement, which is the ability to be able to recognize where the child's at and engage them in a playful, joyful, loving kind of way. Nurture, which is exactly what it sounds like, just being that safe base and being able to let the child come in and get comfort when they need it, looking after them, doing those really basic caregiving tasks that involve things like touch. So rocking, feeding, hugs, that kind of thing. And challenge. So letting the child do things that are challenging to a developmentally appropriate level. So allowing them to encounter a little bit of risk, a little bit of challenge, and helping to support them to meet the challenge without you doing it for them, but kind of setting it up so that it's a level that they are able to meet or they can be supported to meet. And I think you were going to ask about TheraPlay anyways. So that's like kind of in a nutshell.
Yeah.
I'm definitely not the best at describing that compared to other people. And I haven't done much of it. So I'm definitely not describing it that well, but generally that is what it targets. And the thing that's really nice about it is it's really focused on collaboration with the parent or the caregiver. So initially there is an assessment stage where we're collecting a bunch of different historical information and current information about what's going on for the child, but we're also observing. So usually it'll be a videotaped session with the child and the caregivers, and we can get information about each child's relationship with the caregiver and what things look like in those 4 dimensions. So we can assess and talk to the parent about areas that are really great and areas that might require a little bit of support. And then we can build a plan collaboratively based on that. And the thing that's really cool about it is it's just fun. It doesn't mean it's not uncomfortable for people, because this is stuff that sometimes parents are like, oh, I just don't really know how to do that. I just kind of struggle with that specific thing, because it's just like not in my normal way of parenting. But that's why it's obviously a therapeutic model supported by a therapist who really can just tailor it to fit for the parent's comfort level, but also support them through building on these structure, engagement, nurture, and challenge tasks through different play activities. So once you get through the initial assessment phase, you can incorporate different play-based activities that are relational, that the parent and child do together, that capitalize on all of these different dimensions and that target whatever specific one we might be working on. So that's a really cool one. I also like Circle of Security, just in terms of what I already talked about, kind of helping give parents a framework for what attachment looks like and understanding how they're showing up in that relationship with their child. There's a few other dyadic therapies that can be really effective. I don't practice this one, but dyadic developmental psychotherapy has had some good results from some people in my network. So that one can be really cool. Again, it's the same kind of idea where it's really trauma informed based on attachment. There's also child-parent psychotherapy, which is another dyadic one, kind of the same idea. There's some psychoeducation, there's some work with the parent and the child together. Also play therapy, EMDR, which is eye movement desensitization and reprocessing. I am sure somebody has probably already talked about this on your podcast that has done a better job than I'm going to do, but essentially it is bilateral stimulation, whether it's by tapping or eye movements, that helps to process trauma. So the idea is that the trauma kind of gets locked in your brain and causes some problems for you, so that once you're actually going into the processing phase, it helps it process through your brain. It sounds like it shouldn't work, but it works. It's really effective, which is very cool. So I love EMDR, and that can be used for parents or kids. Adults or kids, I should say. CBT can be used to treat trauma, cognitive behavior therapy, dialectical behavior therapy. I really like dialectical behavior therapy, or DBT, because we focus on 4 different skill areas. So it can give people really concrete tools to be able to take with them and feel like they're doing something. So it's a bit of a contrast to EMDR, because EMDR is kind of like, you don't really need to do anything. We just need to process your trauma, which is sometimes really helpful, and skill-based stuff isn't always great, and can cause some problems and not be a great fit in terms of like making people feel like they're not doing a good job if they're not solving their problems by practicing like a worksheet that they're given. So I really like to do a comprehensive kind of eclectic sort of approach and really tailored to who I'm working with. But dialectical behavior therapy, going back to that, focuses on the skill areas of mindfulness, emotional regulation, distress tolerance, and interpersonal effectiveness. So this was developed for people with borderline personality disorder by someone with borderline personality disorder, but it can be used to treat all kinds of different things and is really effective. So I really love bringing in some of those skill areas where people might be struggling with certain things. Distress tolerance can be a really big one, because if somebody is dealing with the effects of trauma, it can be really distressing. So to be able to help people to figure out how to cope with that and get through it can be a really impactful part of the treatment process. I don't remember if you asked me about treating trauma in children, or if this is the question for adults.
This is the children one. So yeah, you've definitely given like a pretty full list for sure. You've mentioned a couple things throughout this conversation, but just to kind of put a bow on it, do you have any resources on childhood trauma specifically that you think are worth sharing?
Yes. I have a very long list, but I'm so excited to share this list, because it's like every time I talk to people, I'm like, oh, have you heard of this book? Like even non-therapy people, like I was somewhere the other day and I'm like, you really might be interested in Gabor Mate's book. So Gabor Mate is definitely a good one, speaking of which. So I really love I think it's his most recent book. Maybe he's writing another one. I feel like he's always writing a book. The Myth of Normal is the one that I'm talking about, because I really love that it really like dissects all different areas of society and our relationships with people, and where there are problems and what we can do about it. So that's a really fantastic book. I also really like his book about addiction, In the Realm of Hungry Ghosts. Bruce Perry, no surprise. I love, love, love Bruce Perry's work. He has written some amazing books. He wrote a really wonderful book that is really comprehensive in terms of understanding how trauma impacts kids. It's called The Boy Who Was Raised as a Dog. And then also his book with Oprah, What Happened to You, which I really love, because even though I read his previous book before, I love What Happened to You because it's really digestible and it incorporates so much of his work. It's like he just like pulled it all together and put it in this nice little package that's really easy to understand and easy to read. It was a quick read for me anyways. So I really love those books. And also Bruce Perry's Child Trauma Academy website is a fantastic resource. Lots of different stuff on there. I mentioned Dan Siegal earlier. So Dan Siegal, again, his hand-brain model, that is really helpful sometimes, but some of his more detailed work includes a book called The Whole Brain Child, which really dives into the brain development process and how parents or caregivers can respond in different ways depending on what's going on in the child's brain development. Parenting from the Inside Out is another book of his. So that's more geared towards whatever has happened for us as parents, looking at that and understanding how that impacts our own parenting of our kids. He has written some other ones that I have not read and do not remember the names of, but he's written all kinds of books and I'm sure they're all amazing. Gordon Neufeld, I think I mentioned earlier, he wrote a book called Hold On to Your Kids, which is really all about his attachment model, which dives into different steps in the attachment process. And the focus of the book really is on how to make sure that our kids maintain an attachment to us and want proximity with us rather than peers, because often they end up more with a peer orientation in terms of attachment, which can cause some problems. Gabor Mate is actually also a co-author, but the book is written in Gordon Neufeld's voice, and I just love Gordon Neufeld. Bessel Kolk has written a wonderful book called The Body Keeps the Score. It's really about a lot of the concepts we talked about. The body does keep the score. So we can experience trauma even if we don't remember it, and it can be held in our body in different ways and have all kinds of different impacts on us in terms of long-term outcomes, mental health, physical health. Another organization that I really like is called Beacon House. It's an organization out of the UK. They have a really wonderful short video that I've shared with all kinds of parents and caregivers about brain development that talks about Bruce Perry's work and talks about the impacts of that and how we can work together to deal with that. The Alberta Family Wellness Initiative has the brain story training, which is a really, really comprehensive, super detailed, but amazing training about neurobiology and impacts on mental health. So that can be a really good resource if somebody's really wanting to dive in there. I think it's like 30 hours, so it's not like a fast process, but it's really detailed and amazing. Nadine Burke-Harris has a really great TED Talk. She's a doctor in the States, pediatrician, I think specifically, and she did this amazing TED Talk talking about a lot of the concepts that we've talked about today, and basically just her journey through her work, becoming more trauma informed and recognizing how trauma affects kids that she's seeing in her medical practice. That it's such a good TED Talk. Oh, I'm going to be going on for a little bit. Sorry. There's so much out there, which is amazing because there's like, if something doesn't fit, there's something else that is a better fit. The National Child Traumatic Stress Network also is a really good website in terms of like defining what child trauma is, different evidence-based trauma therapies. So there's a whole bunch of other ones on there that I didn't mention, and different trauma resources. And the Harvard Center on the Developing Child also is really great in terms of recognizing the impacts of trauma on brain development. Lots of resources, lots of stuff about executive functioning and impairments there. Okay, so I think I might be done with books and websites. Now I'm going to switch gears to like actual local resources. So Caria offers Circle of Security and TheraPlay. I don't think the TheraPlay specifically is like on their website, here's where you get TheraPlay. They've got programs where they offer TheraPlay or they have therapists trained in TheraPlay where you can access that service, or some trauma-based or trauma-informed attachment-based therapy. And Kindred also has Circle of Security groups that they run, and they have therapists trained in TheraPlay. And the other piece, this is like really a niche, but maybe it's helpful to somebody. The program that I used to work with, the Brief Intervention Caregiver Support Program, is now run out of Kindred. It used to be shared amongst 3 agencies, but Kindred has the contract for that program, which we affectionately just call BICS. And BICS can be really helpful for people that have a child in care, in their care. So if somebody happens to be listening that is involved with children's services and doesn't know about this program and is feeling like they would benefit from it, they can always talk to their case team about how it might look like to access that program. I'm pretty sure it's still available. But it's just a really great program to help support caregivers and understand a lot of the concepts that we've talked about. I think that's all. I think that's all I've got. It's not all I've got.
That's a great list.
I could talk about this for half an hour, but I'm not going to because I recognize we have a time limit.
No, I think that's amazing. We're definitely going to link all of these resources you just mentioned in the show notes. This has been a really, really robust kind of crash course on child trauma, which I think is fantastic. Is there anything else you would like to share before we close out?
I don't think so. Not anything really specific other than I just really want people to know how common this is, unfortunately. And that people aren't alone and people are doing the best they can because people have a lot of shame around this. And because it can really impact people's internal working model and their sense of self, people can really feel like there's something wrong with them. And there isn't. It's like you said earlier, it's not about asking what's wrong with people. It's about asking what happened to you. And once we start asking those questions and digging into this stuff, and sometimes we don't even need the details, we can heal people. We can heal together. People can heal themselves and we can break these cycles of trauma. So I think that's just really the most important piece of this. And the reason that I'm so passionate about this in my work is that childhood trauma affects so many things and it touches everything in society and everything in society affects it. So there's just this interplay of factors that really needs to be broken. And I think people feel like they don't really know how to do it, but really doing our own work and impacting things in our own relationships with our kids, or even if we don't have kids, just doing our own work is sometimes so impactful. It is impactful. It can feel like we're not doing enough because we're not dismantling these big systems that are contributing to these problems, but we're impacting our own mental health, which is obviously huge for ourselves, but we're also impacting everybody around us. And that it's really cool. It's really cool to see. So, like I said, I could talk about this for another 3 hours. But I think that kind of touches on everything that you wanted to chat about. And it's really so much more complex and detailed than even what I've been able to get into today, but I'm hoping that was helpful.
I think it was very, very helpful. So thank you, Natasha, for being on the show today. If anyone is looking for more information about her and her practice, as well as the resources shared, you can see our show notes. The Breaking Free Foundation offers therapy grants for trauma survivors in Alberta, and we also host 2 free support meetings a month. One is in person in Calgary, and one is online. For more information on trauma therapy and our organization, please visit us online at breakingfreefoundation.ca. If you enjoyed this podcast, please subscribe and share. That's all for now. Stay well.